I'm Dr. Home Chaudhary. I've come here to introduce a deadly disease which doesn't have any treatment, cure, but which is totally 100% preventable. It is the only dreaded disease in the world where one can guarantee its total control. It is non-infectious. It's totally 100% carrier dependent. Marriage spreads thalassemia. So screening is very important before marriage, and the right selection of partner is very essential. 2 points. One, if there is no marriage, there is no thalassemia. If there is no carrier, there is no thalassemia. If there is one carrier in a couple, no thalassemia. Only if two carriers marry, then their offspring has the chance of having 25% of thalassemia. But the carrier is 100% normal. The duration of identification of thalassemia is in 1925. With this 98 years, only 10% of the population know about thalassemia and 30% knows only the name. That means it has not been circulated, just like polio or COVID. In poliomyelitis, where millions were handicapped and millions died, when the world was busy with improvisation of treatment of polio, someone, a Rotarian in Philippines, he thought of eradication. And today, the whole world is polio-free except 2 countries, and that within a few short period, this will be eradicated. Like that, thalassemia is totally preventable. Prevention is guaranteed, but the treatment is uncertain. A victim with thalassemia usually do not survive beyond 5 to 6 years because of severely low hemoglobin, early breakdown of RBCs, and initial 6 months it is not usually diagnosed. The baby presents with pallor, difficulty in respiration, temperature, repeated temperature, diarrhea. Baby is sick, and then question of diagnosis comes. Now once it is diagnosed, the treatment starts, and there is no treatment. Treatment is to keep the hemoglobin level up to 9 to 10 grams. And for that, weekly or fortnightly or monthly, blood is transfused. Transfusion is number 1. Number 2 is bone marrow transplant. Number 3 is chelation. That means removal of collected excess amount of iron in the body. Thalassemia is anemia, but not the usual variety of anemia where iron is essential for the treatment. Here iron is in abundance. We'll have to remove the iron, either through tablets or through injection. This is a horrible situation. It is costly, very much costly. And about 60% of the collected blood is diverted for the treatment of thalassemia, which is about 2 million bottles of blood in India every year. In the prevention side, it is guaranteed, as I told you. One is HPLC test, high performance liquid chromatography test before marriage and after first conception, if the first one is skipped. 10,000 to 15,000 thalassemia children are born every year, and total permanent patient is about 1 lakh, and every year 1 lakh patients die, and every month 110,000 babies take blood transfusion, and throughout the world 7% of the population is carriers. Legendary figures like Amitabh Bachchan, Pete Sampras, Zinedine Zidane, Jackie Struff, Anisha Patel, they all are carriers. They are legendary figures. They are absolutely 100% normal. But if only, as I told, if both the carriers marry, then only there will be a chance of thalassemia of 25%. So our appeal is prevention. Prevention and treatment ratio is 1:16 in a monetary value. If we are successful, if we can eradicate thalassemia, then we can save millions of children, we can save millions of bottles of blood, and we can save $1 million. 8th May is a Thalassemia Day. We appeal to each and every one of you to not only celebrate, but to remember the millions of children's death, and we should take a pledge that this should not happen again. And our intention is awareness, awareness, and awareness program. Thank you.